Hi guys, so this is the second video. If you're curious, the first video is about the tools that we use for pap tests, pap smears, which is what we use to screen for cervical cancer. This video is about tools that I personally use for IUD insertions. And let me preface this by saying I offer every single patient of mine pain relief. Okay, not that it's going to be painful, it's the possibility that it might be painful, and patients should go in knowing fully that it's, you know, it may be easy, it may be difficult, whatever. I find it easier to insert IUDs for patients who have had a vaginal delivery before. Things are usually less painful in that regard, but I still offer everybody pain relief. Okay, we can talk in another video about the pain management options for IUD insertions. If you guys are interested, please let me know in the comment section below. I only want to make videos that people care about. Okay, so we use the speculum again to isolate the cervix, because that is the entrance to your womb basically, and the IUD is supposed to be inserted into your uterus, okay, which is your womb. All right, so we use the IUD, we use the speculum with the pap light. I call this a pap light, I don't know, it's just light, so that we can see where we're going. Then we open it up to isolate the cervix, and then yeah, so then it's stable. So one of the tools that we use is sponge forceps. Can you see this? I know it's in a bag, but basically I use this to hold the stuff that I use to clean the cervix. So I use gauze with betadine to clean the cervix. I will use this to hold that, and I will clean the cervix with that. This is a tenaculum, and I think that, can you see the pointy edges? Yeah, the edges are kind of pointy. We use this to hold the cervix so that it's stable and it's not flopping about when we're trying to measure your uterine cavity, which is again your womb. I would say this is one of the steps where people can feel pain. So when we clip this, I usually try to confuse the brain by asking the patient to cough. Again, we've already done pain relief with this, but I ask the patient to cough just to distract the brain from focusing so much, and then I clip this to hold the cervix in place. This is a uterine sound. Basically, we use this to know how the size of your uterus, how deep your womb is really. And I would say at this point is another point that patients can feel pain, because sometimes when you access the uterine cavity, the uterus can respond with cramps, and that can be painful. So again, we have pain management options for that. So this is a sound. It usually goes all the way. Most people are between, I would say, 4 and I think the largest I've ever gotten was around 8 centimeters or 9 probably. And that's how we know how deep to insert your IUD without perforating your uterus, really. This is a pair of scissors, and we use this to cut the IUD strings when we are done. Yeah, so basically those are the tools that I use for IUD insertions. At your IUD insertion, you can have a swab for STIs. I always do that, or for bacterial vaginosis or candida, which are not sexually transmitted infections, but can cause cramps when we've had a pelvic procedure like an insertion. Yeah. So let me know if this was enlightening. Let me know in the comment section below if you've got any questions, and I would be glad to answer them. I'll see you in my next video. Bye.